Good morning. Welcome back, and thank you for joining us for the second half of our program on creating a foundation for well-being, addressing our students' food and shelter needs. As a reminder for questions today, since we are live streaming, we would ask all participants to please ask your questions via Slido. Please go to the website Slido, sli.do, and insert code ACHA PGM-PGM2. So again, that's Slido, sli.do, with the code ACHA-PGM2. We will queue your questions and we'll ask them of our panelists throughout the day. To kick things off this morning, it is my distinct pleasure to introduce Susan Hochman, Assistant Director, University Health Services, the University of Texas at Austin, and Vice President for ACHA.
It's great to see you all again today. Welcome back to our second day of ACHA's Leadership and Innovation Summit on creating a foundation for well-being. This is the Addressing Our Students' Food and Shelter Needs track. Again, my name is Susan Hochman, Associate Director at University of Texas at Austin and VP of the American College Health Association. Yesterday, we heard from some excellent panelists that provided some great insights into innovations being applied to campus food insecurity and homelessness. Today, we're going to take a slightly different angle on the topic and explore concepts of measurement, communications, and partnerships as we look to how we implement solutions, encourage their adoption, and measure their efficacy. We are very fortunate to have an incredible lineup of talented and passionate panelists today. At this time, it is my pleasure to introduce our first panel, which will be a session entitled Addressing and Measuring Basic Needs and Concepts. Joining us today are Sherri Darrow from SUNY Buffalo. We have Cindy Leung from the Department of Nutritional Sciences and School of Public Health at the University of Michigan. Devin Payne-Sturges, who is joining us from the Maryland Institute of Applied Environmental Health, School of Public Health at the University of Maryland College Park. And our moderator today is Jamie Davidson, who is the Associate Vice President for Student Wellness at the University of Nevada, Las Vegas. So, Jamie, I'm going to hand it over to you.
Well, thank you. I also want to add that we also have Jeannie Harris-Caldwell, Dean of Health and Wellness at Saddleback College, immediately to my right, joining us today. So we have some great panelists, and this is a very important topic. So I will start with our first question. As a researcher, how does one define a broad concept like food insecurity or homelessness? And what are some of the forms these issues take on campuses? And how does one evaluate and measure concepts like these for research purposes?
So I'd be glad to start. This is Sherri Darrow from the University at Buffalo, because what I'd really like to do is step back and take a big view of what these things mean. Recently, I was looking at the 12th Congress for the World Health Organization that talks about global changes in terms of how it impacts health and well-being. And I think it's a really important picture to keep in my mind, and if you all have not seen that, I would encourage you to look up the graphic because it's very helpful, and every time I do share it, people are like, oh, okay, I need to think about that. So right now, the world is seeing the largest migration of people that we've had in recorded history. That's being impacted by or caused by, whichever way you want to look at it, climate change globally, and increased disparities in terms of wealth and in terms of access to health. And they look at health as being probably the most important pivotal issue for humanity in our current time and going into the future. And this is the milieu in which we're all operating. We're feeling it, we're seeing it, but we don't always look at it that way. So if we kind of get a little bit closer and look at the United States, during the New Deal, there was a consensus that people who were poor and who were in need, it was not because of them, some defects in themselves, it was because of social and economic conditions, and that agreement has been eroded steadily, so that currently all the ambivalence has been what's bubbling up, so that now poverty is probably one of the most politicized issues in the United States, where the idea that people are looking for handouts and are not worthy is more of what we're operating under. And so I think people expressed this yesterday in terms of measuring and thinking about food insecurity and maybe homelessness on our campuses, that our administrators might not believe that that's the role of a university, to be a social service agency, even though all these other forces are going on internationally, globally, and nationally. So I think that's an important piece.
If I can speak off of that, how do you do? I'm Jeannie Harris Caldwell. I agree with you 100%. I don't think that all of our administrations are embracing the changes that we're seeing across our campuses. And I speak from a community college perspective in the state of California, and we have 2.1 million community college students in California alone. Some of the data that I want to share with you today is about 33% of our students report that they don't have enough resources to cover housing, and about 22% are having a difficulty paying housing and utilities. We see about 55% of our students that are food insecure. So I do think that it is a bigger picture that we are having to focus as health and education merging into not just we're a mission of education, but we do have to look at the social service in order to let our students be successful, to persist, and to graduate.
Good morning, everyone. My name is Cindy Leung. I'm from the University of Michigan. I am primarily a food insecurity researcher, so I can speak a little bit about how I define food insecurity. And I agree with everything our panelists have said. Food insecurity, I always go back to the USDA definition because I think it's the most widely accepted. And so that's the limited or uncertain availability of nutritionally adequate and safe foods, or the limited or uncertain ability to acquire these foods in socially acceptable ways. So if we think about food insecurity, it encompasses food availability and food access, the fact that foods need to be full of nutrients that our bodies need and free of contaminants and toxicants, and the fact that food should be acquired with dignity, so that we shouldn't resort to students using a food pantry on campus or stealing food from the dining halls to make sure that they have enough food to get by. Food insecurity is, like our panelists said, it's a socioeconomic condition of not having consistent access to food. And from a research standpoint, I think it's the uncertainty of food that causes a lot of poor outcomes that we see in the literature. So everything from chronic diseases like diabetes, cardiovascular disease, to mental health needs like depression, anxiety, and suicide. It's the uncertainty where throughout the month there is not consistent access to food, and that's leading to these behaviors that we see around binging when there is food available, or choosing less healthy foods because of our innate stress response to focus on alleviating our stress when we're food insecure. And so just as Sherri was saying, I think we need to change the perception on our campuses that food insecurity exists. The last USDA report just came out on the national prevalence of food insecurity. So the national prevalence is 11.8%. But on our college campuses, the reports have shown that it's anywhere from 30 to 45%. And so from a college perspective, we are drastically higher than the national average. And so we need to change the perceptions that college students should be eating ramen to get by, or college students are not food insecure because they have dining plans. These are things that I've heard on my campus, in my school, in my department. And so even though we have the data to support the fact that students are food insecure, there's a lot of people who just don't want to believe that college students need social services or a more consistent access to food.
And we have another panelist joining us. This is Devin Payne-Sturges, School of Public Health, University of Maryland, College Park. Welcome.
Good morning. Good morning.
So that's some alarming information that we shared. So what are some of the other basic needs, issues students are facing that we might not know about on our campuses?
Well, one of the things that has come up and that I know our Governor Cuomo, responded to was inquiries or statements by students that they were having to choose between textbooks and food. And, again, the bigger picture, the cost of textbooks has skyrocketed in the last decade. And like people have also said yesterday, food is something that people often view as something that can be skimped on. You can't necessarily skimp on what it costs to pay, for your rent, for example. And a lot of students will go without textbooks in order to be able to eat. And of course that, again, negatively impacts their ability to do well in a class or to even stay in a class. So just like everything, we found that there's an interaction of things, like we're talking about homelessness and we're talking about food insecurity. So those things go together, but it's also, if you know that lack of food has to do with finances, thank you, lack of financial security, it's going to impact everything. But the textbook issue, I think, is a particularly interesting one that we can address by having textbooks available for people to use.
One thing that we're also measuring on our campus is that of transportation insecurity, and that's because we have a faculty member in sociology who's developed a measure of transportation insecurity similar to the way the food insecurity items were developed. And so we're currently measuring that in our students. University of Michigan, Ann Arbor, we happen to be in a food desert, so unless you want to pay a lot of money to get bag of food from the local food co-op. Some students don't have cars, and especially in the winter, we can't expect students to take an hour-long bus ride to Meyer and then wait another hour to take the bus back home. So we're measuring transportation insecurity in addition to food, housing, and financial insecurity.
Yes. So good morning, everybody. My name is Devin Payne-Sturges. I'm from the University of Maryland. In addition to measuring prevalence of food insecurity among our students, we're also measuring indicators of depression and anxiety. We've also covered measuring the issues around housing instability. I had conducted a pilot study on food insecurity on my campus in 2015, and we discovered that 15% of our undergraduates met the definition of being food insecure, and another 16% were at risk of being food insecure, which if you look at from the other side, that's like 69% only 69% met the full definition of being food secure. But I bring this all up to say that the results of that study sort of led the administration to do a larger study. I only did a survey around 300 students, whereas another study was conducted through the counseling center, and they were able to reach 4,000 students. And part of that was not only measuring food insecurity using the USDA survey questionnaire modules, but they also were able, because they had the resources, to do structured interviews with some of the students who had responded to the survey. And so it was through some of those interactions that we also uncovered some other issues around the transportation, for example. Some students talked about how, believe it or not, in College Park, if you don't have a car, you don't have transportation, there aren't any really, quote, good grocery stores within walking distance from campus. So students articulated how that was a concern for them, and they also talked about how there had been some policy changes on our campus about our campus bus. Some of the routes had changed, and apparently, I don't know this because I don't rely on public transportation, that some of those bus routes had changed so that they weren't running as frequently, or they weren't running on weekends, and they used to take a route that would get them to like some grocery stores. So it's really important to do these kinds of surveys and analyses and studies to bring the information back to the administration, because while I would say that the root cause of all of this has to do with financial resources, there might be other things along the way that a university and administration could address.
If I can add, for our campuses, we also did focus group studies for our students that we surveyed. And what we found was not only the food and clothing, or the food and housing insecurities, but we also found that they had clothing insecurities. We found that they often did not buy toiletries because of the cost of toiletries. So a lot of the solutions that we're focused on were to find resources to provide clothing, secondhand clothing stores, to provide toiletries for the students, to provide food in farmers markets so that there is dignity and not just accessing a food pantry where there may be a stigma attached to it. So we're very conscientious of where the food pantry and the farmers market was put, so there was a confidential way in, a confidential way out, and it didn't have that stigma related to it.
So are there other contributing factors? We've talked about transportation, certainly has an impact, strains finances. Are there other contributing factors that impact these problems that are affecting our students?
I think that we're also seeing an increase in mental illness. We're seeing additional stress, anxiety, especially from a health and wellness perspective. They're overwhelmed, and having one more item on their plate can be the breaking straw for many students. So I think that we also are addressing a greater need from our mental health needs for our students than we've seen in the last 10 years.
Related to that, it was brought to my attention that if we want to do or take a health promotion approach on our campuses, that as we build resilience efforts, we want to also normalize help seeking, because that is a way to encourage the students to come forward with whatever their needs are. And so I thought that was a really good connection to make. This is Sherri Darrow again, and I guess I'm going to talk about something related, which is how, in terms of measuring food need, food insecurity, that we likewise have to map the capacities on our campuses to respond to it. In some ways, measuring the problems are the easy part. Not to say that, it's 1, 2, 3 easy, but it's very much like, what have we tried to do to build comprehensive responses to high-risk drinking on our campuses? we all know the statistics and we can say them by heart. And in terms of food insecurity, we know it's somewhere between 15 and 50%, no matter who's measuring it and how we're measuring it, and that all these things are, related. The examples people gave about textbooks and transportation and clothing. But, how do we map the capacity on our campus and the need on our campus from other ways? So, for example, what percentage of our students are getting financial aid and Pell Grants and things like that, because that's something that administrators might respond to. In terms of SNAP, what are the state requirements? Is there anything that we can address? How can we make applying for SNAP easier on our campuses or with our campus population? And what is the role of campus dining on our campuses? Again, I found the presentations yesterday really helpful for me to think about how can I meet separately with the director of campus dining and shops to identify what can be done, because publicly there's a lot of I can't do this, I can't do this, I can't do this, if we use examples from other campuses. And the people in that organization really do have a different model than we do in health promotion. But we also know that the university is dependent on them for a certain amount of income, things like that. So mapping those capacities, I think, is a really important part of trying to respond to the problems.
If I could just piggyback on that. So on our campus in College Park, the larger survey that I mentioned really struck a chord with some administration officials. And I was there at the presentation when the results were revealed, surveying a much larger number of students, still, though, coming up with very much the same numbers I had come up with a pilot study. And we presented to our Dean of Undergraduate Affairs, as well as the leadership of UMD Dining Services. And what was interesting was just to watch the expressions on their faces. Their jaws were dropped. They even said, wow, these numbers are really sobering. And so we're happy that, okay, now they're paying attention, but the next step is, okay, what do we do about it? And I personally am struggling with that, how to get our administration to move beyond just acknowledging that there is a problem to actually thinking about solutions. But I really like what you're saying about trying to map the capacity on your campus. But as these results were being presented, and especially the results from the qualitative interviews, some of the students who were interviewed, they actually offered suggestions and solutions. And so some of them are being pursued. I can't tell you right now exactly if they're fully being implemented, but for example, there were some students talked about, well, it would be really great if there could be refrigerators and microwaves on campus for the commuter students, so they could, bring food from home that they've already prepared instead of having to be subjected to the retail prices of some of the, outlets in the food court at the Stamp Student Union. And then also, as a result, I think the UMD Dining Services, they are considering offering a lower cost meal plan just for commuter students. So there's just a couple things I wanted to share about. They're small things that the university could do.
If I can add, one of the solutions that we've come up with within California is the SNAP program is offered at many of the colleges through the health centers. So the students can come to the health center, fill out their application for the SNAP program. And one of the other solutions that we're trying to work with is to be able to have our EBT cards, the SNAP program, accessible to buy meals in the cafeterias, so that their EBT card could be used actually as a meal card, because so many community colleges are commuters. We only have about 11 with actual residential halls.
And at University of Michigan, about a year ago, we started a on-campus working group of people who care about student food insecurity issues. And so we have representation from our student government, from our dining services, from Dean of Students, financial services, our university health services, our counseling services. So basically, all of the stakeholders around student services are at the table. And we've been having weekly or monthly meetings around, how do we find solutions to food insecurity on campus. And as part of this working group, we've identified a permanent place for our campus food pantry. So in the past, it's been a monthly distribution, and basically students line up outside on the street to get a bag of food. And starting later this year, we are working with M Dining to basically refinish a basement of a residence hall that could be used to open up a permanent food pantry that will be open 4 or 5 days a week for the whole day. And this has only come up because we've all been sitting at the table talking about this issue together. So I know very little about building codes and spaces on campus that could be used for these purposes, but people at M Dining do, and people over at Sustainable Food Institute, they know of donors, and they work with our campus farm. And so together we've been able to source foods and make sure that the space is up to state and county standards, and basically will be a permanent food pantry moving forward in the winter semester. So that's an example of how people with different knowledge about school policies and the data can come together and really identify a solution. However, last week or 2 weeks ago, I was at the #RealCollege conference in Philadelphia, which is run out of Temple and the Wisconsin Hope Center. And a big theme of that conference was pantries are very important, but they are not the solution to food insecurity. So we all need to have pantries where students can access food if they need it, but we shouldn't see it as, okay, we have a pantry, food security is solved. And so just, being mindful of that attitude.
Yeah, I just want to piggyback on that real quick. In fact, University of Maryland College Park does have a food pantry. It opened in the fall of 2014. It's available to not only students, but faculty and staff. So there are some interesting implications of the numbers of people who are coming. We're not just talking about students, we're actually talking about university staff. But what's interesting is that when that pantry was established, the campus really didn't have any more than anecdotal evidence that there were these issues on campus. They had heard different stories from people who run dining services. They had heard different stories from people who work at the health center, about student struggles. And so they put this pantry on, they created it. It actually is now permanently housed in the health center. But what's interesting is that they didn't have, the data to support that there was a need to have this pantry. And I think that's where I sort of stepped in to say, well, how do you really know that there's a problem on this campus? And said, well, we just have these, these stories. So we did the survey. There was even a larger survey done. And I think the results of that larger survey absolutely helped the administration realize exactly what you're just saying. That it's great that we have this pantry, and maybe we felt very good about establishing that, but the data are suggesting that there's deeper, larger issues, and that a pantry is not, the solution to all of those problems.
If I can piggyback on the Real College survey, many of your institutions will be able to complete the survey, #Real College. Next fall, it'll be released again through Temple Hope Lab. It's Hope Lab for me, but it's Temple Research, I think, is what it is. I'm looking for my colleagues to make sure I'm telling you. But if you go to #Real College, that survey is accessible to your students, and it would give your institution tremendous amount of knowledge about the food and housing insecurities within your own campus.
So the research you've been sharing is, certainly encouraging. So that was my question. For institutions that haven't really done serious assessment, of their students, what's a way to start? So obviously we have this Real College survey that'll be available, but as researchers and practitioners, do you have other ideas on where institutions can start?
So this is Sherri Darrow from the University of Buffalo, and we are a large public university. And the issue first came up through practitioners who had students who were mentioning things to them. So our dietitian, our pharmacist, right? So we knew there was an issue, and we were about to implement the National College Health Assessment, and this was back in 2013. And at that time, or still, there's no questions on the NCHA that specifically address this, and so we added the USDA questions as our added questions to the NCHA. And that gave us the result that 25% of our students, depending on which question you look at, are food insecure. So I would definitely encourage people to add custom questions like that. If you're doing other large surveys that are already going out to many students on your campus, just to say that the NCHA revision, the new one that we're working on right now, will include food insecurity questions. There'll be 2 that are boiled down from the USDA questions that show a lot of reliability and validity, and so that will help. And like I said, we have those numbers and we've shared them, but there's still a lot of disagreement about what that means and, what's the role of the university, things that I was alluding to before. But I also want to say we are now doing focus groups with students, and we have a very limited time in order to come up with some options to give back to the vice president. And so we've decided that those focus groups are going to be, we're going to seek out students who have already asked for some help in some ways, so through our emergency fund or our EOP office, so that we can get a sense, a more rich story about what their situations are and why they're food insecure. So that's another way to see what's going on your campus.
I agree with you, Sherri, 100%. The surveys are a way to go to start with baseline data and to add your custom questions if you can. Ours came about 2013 as well, and we were tracking the number of students that we responded to in an emergency whose blood sugar was below 65. And so we saw a tremendous trend on the number of responses that we would go out where students had, quote, fainted, felt lightheaded, been dizzy, and we started tracking that data. What it shared with us was that we had a significant increase in the numbers of students with low blood sugars, and we would bring them back to the health services center, hydrate, and usually give them a granola bar or something with some protein in it, and bring those sugars up and then release them for a safe discharge. So after tracking that, we brought our the 2013 NCHA survey questions. We also added custom questions that brought results to us that showed us that we were having several food insecure students. And from that, I just encourage you to complete those surveys through your institutions, because you have not only the cohort of the aggregate data, but you also have your specific data for your campus.
This is Sherri again. I just want to add something about the Hope Lab, now changed,
Yes.
group that's doing the Real College Survey. So in New York State, the governor has, said they want a response on every campus, and we are like 64 different campuses, community colleges, technical colleges, colleges and universities, so there's a real difference on our campuses. In any case, part of being part of this SUNY task force is to implement the Real College Survey on your campus. So I had brought this to people at UB, and the folks that help us with assessment and research basically came back saying, we don't think it's a really good idea for us to do locally, and this is why. And they had really good reasons. SUNY wanted us to do it like next week kind of a thing, and there were already 6 competing surveys going on. So the whole issue of overloading the students with surveys is both a burden to them, but also people are not going to get responses, so that the response rates are just awful. There were other issues as well, which is that there's a general link that they were sending, and that would really mean that people could do the survey a number of times. And with some of these hot button issues, even though it doesn't seem like why would somebody do that, people actually do, because they're concerned about food insecurity. And also, we were not going to be able to get the data back to look at our campus alone, so that we could kind of see how that would intersect with other things that we're trying to measure. And so, even though it's a valid survey, the survey also was really built around the community college experience, and so that's a little different as well. We will instead be doing our own surveys, and like I said, the new NCHA will include it. So one of the things that our research people did do is that they're trying to consolidate the questions that we're giving to freshmen in terms of new student surveys, because that's another group that gets highly over-surveyed. And so they did ask a question about food insecurity for the students, and it was very interesting. So looking at new freshmen and new transfer students before they get to campus, and the question that they asked about finances and food insecurity, 15% of the freshmen and 30% of the transfer students said that they had either frequent or sometimes food insecurity. So those numbers are in. That's even before they get to our campuses, and it'll be interesting to see what the follow-up is. So I guess the bottom line here is work with your research and assessment people on your campus to see what might make sense for your campus as a whole, because there are a lot of surveys for our students that, overburden them and then ruin our response rates and then therefore our data.
If I could just make a comment on that, that's really interesting that they were able to survey students as they were coming to university, because that, as a researcher, that's a question. I mean, most of these surveys that I guess you all have talked about that have been done are cross-sectional, they're one snapshot in time. But, a question is, what's going on over time? What are these students experiencing even before they come to college? Is this something that's unique about being, a college student? What happens after they leave? So in terms of sort of data gaps, in my mind, I think a longitudinal work is really needed. And to also really make the connection to what I would believe to be sort of the bottom line for universities is, how does this all relate to the academic achievement and performance of students? I feel that if we can help our administrators see that this is addressing or impacting the bottom line, that maybe this will also be a way to convince them to pay attention to this issue. And certainly some of the previous studies that have been done have shown that food insecurity does impact student learning. And I don't mean just the rich literature that's out there about young children and adolescents. I'm talking about some of the work that's been done recently looking at college students. Food insecure students more likely to have lower GPAs, more likely to withdraw from class or withdraw from the whole institution. So I just wanted to bring that up.
And if you look at it from Maslow's hierarchy of needs, it's one of my greatest analogies, because how can you have self-actualization and learn if we can't meet basic needs of food, water, and shelter? So when I bring things to my administration, it's what I use. I use Maslow's pyramid, and I come back and I'm like, our students are not going to persist, they're not going to graduate if basic needs aren't being met.
Before I was at Michigan, I was in the University of California systems, and a co-author on a paper that had analyzed data from all 10 UC campuses, and what we found was a 0.3 point difference in GPA between food secure and food insecure students. When I came to Michigan and I did a survey, I was able to link it with registrar data on GPA. And what we found was a very linear association between food security and higher GPA. exactly the same magnitude, 0.3, between our most extreme food insecure students and our food secure students. So the surveys and the ability to link it with registrar data has been really helpful in showing that it is an academic issue. And then another part of my research has been around qualitative data. So some of our panelists have discussed focus groups and interviews. These mechanisms really help to identify how these associations are being manifested among students. And so when I was at the University of California, Berkeley, we interviewed students from the food pantry. Well, we recruited students from the food pantry, and we asked them to tell us about their experience with food, and particularly how their food situation impacted their academic achievement. And what we heard from these 25 undergrads was that there were two different mechanisms for which food insecurity impacted their academics. One was the physical aspect. So students didn't want to go to class if they knew their stomachs were going to be rumbling and they were in a small discussion section and it was going to be embarrassing. We heard that students would sleep a lot because sleeping helps you forget that you're hungry. And then you're oversleeping, but you're not sleeping well, and that impacts your ability to focus the next day. So there was the physical manifestation, and then there was the mental manifestation. And so students who are food insecure said that they were constantly trying to figure out where their next meal was going to come from. If their classroom is in this building and they're trying to get to the other building, where are they going to stop for food along the way? And is it this day that Subway has these sandwiches on sale, or how do they get to, how do they get the foods that they want on the limited budget that they have? And students said that they're constantly thinking about food and how to get food, and that really impacted their ability to listen and to take notes and to focus on their studies. And so I would say that quantitative survey data is important. Qualitative data can add a whole other dimension that quantitative data is missing.
So we have some questions from audience members. Kellen?
Okay, so questions from Slido. For Jean, did you use your own data from responding to emergency calls on campus, or did you partner with local emergency services for those stats?
Those were our data that we were directly responsible for, so we had control of the data, and we could do blood sugars and tracking on the students through the Health Services Association.
What suggestions do you have to get buy-in from administrators to get past the idea that a food pantry is not solving the issue of food insecurity on campus?
I think that providing the leadership with data, we have done focus groups and have allowed students who have wanted to come forward for fundraising to share why the college support has been so important, has also been very helpful with our administration. I believe that when you're speaking from the heart and you can back it up with data, that you have a lot more ability to be passionate about what you're trying to present. And I really think that for us, it was the need and the numbers. We presented with the first group of the blood sugars. We then started our food pantry in 2013, and we've served over 12,000 students. And so when administration has that many students talking about the support that's been provided for them to allow them to persist and that they could not have graduated without it, and touching bases on the things that my fellow colleagues have shared with you, that they were able to concentrate on their classes, it's raised to a level that it is an accepted practice within the community colleges in California.
I know for us at the University of Buffalo, the vice president wants to know how will this be sustained over time. So I think having a sustainability plan is also an important part of convincing people. Mm-hmm. And also they want options on how do we address the food insecurity questions so that there's, that we're conveying, that we're thinking about the strengths and weaknesses of each of the options and how they might fit together and how they might also serve different students on different campuses or students who have more sporadic need rather than ongoing need, things like that. So I think that both in our plans, short and long term, that administrators want to see that. And
I think as an education Part of our mission is to share best practices. So I think learning from one another and seeing what works in other colleges has been instrumental in our programs being successful.
What was the name of the survey that was more focused on community college experience that you were not able to get campus-specific data?
I was referring to the Real College survey from the Hope Lab people, but that was how it was being implemented in the SUNY schools this fall. So it might not always be the truth for them.
I have colleagues from University of Michigan Dearborn who participated in the last Hope Lab survey in 2016. They told me that they paid $1,000 for Temple to conduct this survey on their campus, and they were able to get a report or maybe some of the raw data from the Hope Lab after the data were collected. But it's a little unclear who owns that data and what you can do with that data after you receive it. So just a note of caution.
The $1,000 is actually used for student raffle. It's not for the college. So the money is actually given to students. It's $1,000. It's a donation. You are able to get campus-specific data. At least our California community colleges have been able to get campus-specific data. The Real College survey came out very quickly this fall, and again will be administered next fall, which will give people more time if they want to take the time to invest in it or run it through their IRB.
How can we as administrators encourage students to normalize help-seeking behavior?
Reduce stigma.
Yeah.
Peer-to-peer. Make it a common practice, not something that's so behind the closed doors.
We have a campaign called I'm a Wolverine and so this is run out of our University Health Services, and basically it's a student run campaign. Students can say, I'm a Wolverine and I have ADHD. I'm a Wolverine and I have depression. And this is to help normalize these fairly prevalent conditions that people don't talk about because of the stigma associated with it. And I would love to see this extend to other basic needs insecurities like the ones we've been talking about.
Are there differences in the types of variables you should measure on a rural versus urban campus or large versus small school?
I think like other things we might do in our campuses, again, you want to map your resources, your capacities, your barriers, and those can be same or different on all different campuses. We have a suburban and a urban campus, and the urban campus is right across the street. You could walk across to restaurants and supermarket. The suburban campus is you cannot walk to anything. And so that's a difference between the two campuses, even though we're the same university. And so I would imagine, again, mapping the environment and the cultural, social issues going on, as well as the politics, is really what, how those categories are the same, and how you fill in the blanks depends on your situation.
For conducting surveys, I would recommend to not only address the food insecurity, you can certainly adopt the questions from the USDA survey module, but it would be great if the surveys would also address the multitude of issues that we're talking about, because what I've noticed is that many of the studies that have been published, some will just focus on the food insecurity, some will have food insecurity and the academic implications, academic outcomes. Where others might do food insecurity and just housing instability issues. What I'm advocating is it would be great if you were looking at developing your own survey, that you would try to address all these multiple topics.
Do you have access to any data from local school districts that can help you predict future trends related to food and housing insecurities?
I'm sorry, I don't have access to it I'm not sure if anyone of the other group. A lot of times from high schools, K through 12 specifically, that information is not shared once they turn 18.
One panelist mentioned refrigerators for commuter student food storage. Are these facilities regulated or monitored in any way? Any problems arise?
I can share one of our solutions that we have. Because we have so many food insecure students, we have created partnerships, and one of the partnerships that we have created is with Starbucks. Starbucks gives their food away every night in many communities. So we worked with our athletics department, and we were able to get coolers from Pepsi, who was one of our sponsors. So we were able to put chillers, into the tutorial learning resource center areas within our colleges. And on Monday and Wednesday, Starbucks has graciously delivered to us 500 free meals, 250 on Monday, 250 on Wednesday. We don't worry about the storage over the weekend that way. We have temperature logs. My staff all have safe food handling certificates. They check the temperatures on a weekly basis to make sure that they're below 40 degrees, and the food is then put in. We don't have to worry about rotating it because it's gone in about an hour and a half.
What data has been helpful to share with local companies to encourage them to donate food to your school?
I've been on the bandwagon for a year and a half. It took me that long to get Starbucks to agree. But I think a lot of it has been the culture and perception and normalizing that, the starving student is not normal for colleges. So many people were like, oh, when I was in college, I ate top ramen all the time, or I ate coleslaw, and it's not normal. It's not healthy. It doesn't provide good nutrition. It doesn't enhance our bodies. So I think that culture and perception has to change to get organizations to understand the gravity of the situation.
Would anyone in the room like to ask a question? I'm happy to bring the mic around. Back to you, Jamie.
Okay. Well, thank you, Jeannie, Sherri, Cindy, and Devin. The research that you've shared, I think, has been very enlightening for us. So thank you for sharing your expertise with us today.
Thanks.